Lasers have been used to resurface facial skin for over 2 decades. The first lasers that came into regular use in the 1990s would fully ablate layers of skin, leaving a raw superficial wound, somewhat similar to a scraping injury on a knee or elbow, but with no bleeding. About 2 weeks were required to achieve complete healing, and the new skin was pink and delicate for several months. Pain, infection, and scarring were always possible with this type of treatment. In the early 2000s, the fully ablative lasers were replaced with fractional devices that only place tiny holes into the skin, rather than fully ablate the entire skin surface. The untreated skin surrounding the holes allows very rapid healing. The fractional treatments have achieved most of the benefits of the fully ablative lasers, but with much less discomfort and fewer complications. A trade-off is that sometimes more than one treatment is needed to get a good final result. There are several types of fractionated lasers, some of which produce no heat and are painless. The CO2 lasers produce heat, so some anesthesia is required. The benefit of a hot laser is that more collagen remodeling can be achieved, and the final result will be more visible and pleasing. To control discomfort, the Phoenix CO2 Fractional employs a pattern generator that gives a single tiny laser pulse placed rapidly in a random pattern throughout the treated area. Only a very small beam of energy reaches the skin in an instant, with additional pulses distributed widely around the treated area. This scattering of pulses reduces discomfort. Most treatments require only topical anesthesia, but if discomfort is a problem, cutaneous anesthetic injections can be added to sensitive areas. Fine lines, brown spots, and red spots can all be expected to improve with this treatment. If needed, more than one treatment can be done every 1 to 2 months until a satisfactory endpoint is achieved. The carbon dioxide fractionated laser can be used for treatment of sun damage on the backs of hands. It will fade brown spots, reduce or eliminate precancerous growths, and thicken and tighten the skin to a small degree. To prevent complications, treatment is done in 3 light applications of energy, done 1 month apart. Our Rower Phoenix laser has a special adapter made specifically for treatment of the hands and fingers. As sun-damaged hands are a big problem in our patient population, the perimeters for treatment are set up automatically so that the operator needs only to decide whether to do 1, 2, or 3 passes. The number of passes will alter the percent of the skin that receives the laser pulse. The greater the number of pulses, the quicker the final results will be achieved, but more pulses also mean a slightly longer healing time. The operator and the patient together can decide how aggressively each application should be done. The treatment is almost painless and requires no anesthesia. After treatment, the skin will have many tiny, superficial holes visible that gradually close over a 2 to 3 week period with minimal care. Redness will be present for 3 to 4 weeks. Final results will be visible about 1 month after the laser treatment. If the hands are protected from further sunlight, repeat treatment may not be necessary for 1 to 2 years.
All right, we just watched a video, but now we're going to hear from an expert. Dr. George Whitten is here with us, and you know, I'm really excited about this, but what is a CO2 laser?
A carbon dioxide laser that we have will cut, fully ablate, or fractionate. If you use it as a cutting device, it'll actually cut through skin without any bleeding. It will also fully ablate without any bleeding. But what we use it most for is the fractionated mode, where this laser will actually make pinpoint holes in the skin in a little pattern and create microscopic injuries in the skin that then improves the skin as it heals.
Really? So is this something that I can do on my lunch hour? I mean, what was the downtime?
Well, there is a bit of downtime with this. You need to be motivated for this kind of treatment. There's some. It's a hot beam, so there's going to be some heat applied to the skin. And we're making microscopic little holes in the skin that can be controlled in depth or can be controlled in density. So, for example, if I shone the laser on your skin with, say, a 10% coverage, you might not even feel that. But if I did a 50% coverage, you would definitely feel it. And you would probably ooze and be red for several days.
Yeah, but the technology is so exciting because it's going to make me look younger, right?
It's definitely going to fix a few things.
Great.
This is actually the most aggressive treatment that we own. It's designed for people that have pretty severe sun damage, who maybe have some fine lines, some pigment problems, maybe even some superficial lesions that need to be removed.
What parts of the body can you use that on? Is it just for the face?
Well, no. In fact, I had the back of my hand treated just a couple of weeks ago. We have a little scanner that will actually fit the back of the hand, and that's what was in the video you saw. And if you make these little injuries in the skin every month for about 2 or 3 times, it's amazing what will happen to the skin. The brown spots kind of fade out, the skin gets thicker and just looks more healthy.
Let me see. Totally. You know, you've made me a believer. Now I want to try it out myself.